Hello everyone. India has become the diabetic capital of the world. And when we talk about diabetes, one very common question that comes to everybody's mind is that diabetes causes complications after surgery. Is that true? Is that correct? Yes, diabetes can cause complications after surgery if proper precautions are not taken. What is the reason of diabetic patients being more prone to infections? They're actually 1.5 to 2.5 times more prone to infections or other complications than the normal public. The reasons are manifold. That is, diabetics usually have a weakened immune response. The ability to fight infections in a diabetic patient is much lesser. When we talk of healing, collagen is one of the most important parts of a healing wound. In diabetes, our fibroblast cells are affected. These cells are actually responsible for manufacturing the right amount and the right type of collagen. And once they are affected, the quality of collagen in diabetic patients is also affected, leading to poor wound healing and being more prone to breakdowns. Also, it is well known that diabetes is directly proportional to the amount of atherosclerosis in our vessels. In simple terms, diabetes causes poor blood flow. This poor blood flow does not allow the cells which are required for wound healing to reach the proper site, and therefore infection, breakdown, and subsequent non-healing wounds become more common in a diabetic population. So what can actually be done to try and minimize these problems? Well, you can certainly do a few things. One is make sure the surgery happens in the most sterile fashion. Make sure that you stop smoking and have quit smoking well before your surgery. Also, make sure that your HbA1c, which is your average blood glucose level for 3 months, stays below 6. That is the best scenario, but at least below 7. Also, you have to understand that the average blood glucose level does not change on day-to-day basis. Your blood sugar levels on the day or of surgery and the days around surgery should be controlled. It should be between 140 to 160 milligrams per deciliter. Then the surgeon who does the surgery should be aware of the fact that you are a diabetic, should take proper precautions in terms of getting an opinion from a physician or an endocrinologist, and making sure that the blood sugar levels are best optimized around the surgery. If we follow these things, it is quite likely that the complications we are talking about will not happen. Can they still happen? Yes, they can still happen. But if the circumstances are well, if the situation is well organized and managed, it will be minimized, and even if they happen, it will be much easier to control and treat these complications.